preserving my own anonymity. I am a recovering addict and alcoholic and drug user.
It's not every day that you hear a Canadian politician sharing a personal story on an epidemic that's being felt right across the country. But that's exactly what one of Toronto's newest appointed city councillors did at a Board of Health meeting recently. A powerful moment meant to highlight the city's worsening drug poisoning crisis.
I'm not sure that there's going to be another opportunity where a member of this committee can sort of come forward and identify with the communities that we're talking about.
After less than 1 month on the job, Toronto Centre Councillor Robin Buxton shares the impacts addiction has had on their life.
I dropped out of university. I didn't take jobs. I started isolating from friends. And eventually, alcohol wasn't enough. And I started dabbling in other harder substances. And I was just very lucky.
Officials have warned alarming trends are developing and the crisis is worsening. Citing data from the Office of the Chief Coroner for Ontario, it's estimated that in 2021, Toronto had 511 confirmed and 54 probable opioid toxicity deaths, representing a 71% increase from 2019 and a 273% increase from 2015. Last year, more than 2,800 people died in Ontario.
It is a worsening situation and one for which we must continue to do our very best to prevent these preventable deaths that are happening.
Earlier this month, British Columbia became the first Canadian province to decriminalize small amounts of illicit drugs. Health Canada has also confirmed to CityNews that it received requests from Toronto Public Health to do the same. That is currently under review.
I can tell you that we're having very positive conversations with Health Canada, but I don't know that I have a sense as to time.
We need to decriminalize all drugs because we don't criminalize any other disease.
The Board of Health is reviewing Toronto's plans to address this crisis, also identifying a number of key actions, including expanding safer supply programs, harm reduction, treatment and health and social services.
So much of the challenge right now is just a poisoned supply. There are just people who are dying first time because the actual supply is so toxic.
Buxton Ponce is now over 2.5 years sober, crediting family for helping, saying they were lucky.
I had financial abilities to pay for private counseling, and that's just not the case for so many people in our city. It took me so long to get help that I needed and deserved because I didn't think that people with addictions looked like me. And I really just wanted to create a face to this crisis that we're seeing.
Now, CityNews also reached out to the Ministry of Health on Friday morning. We asked questions about decriminalization and Ontario tackling this issue. However, the province did not respond to our media request. In Toronto, I'm Faiza Amin for CityNews.